Hello and welcome to another mini lecture of Professional English for Medicine. The topic of today is still medical practitioners. Now part 1, hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of the four main groups. Group 1, the pre-registration houses officer, or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor. Group 2, a senior house officer, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, but the old term Senior House Officer and SHO are still used. Group 3, a Specialist Registrar, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars. They are doctors who have completed their training but do not wish to specialize yet. Group 4, a consultant, is a fully qualified specialist. There may also be some associate specialists. They are senior doctors who do not wish to become consultants. In addition, there is at least one medical director who is responsible for all of the medical staff. Part 2, medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor clerks them, takes their medical history, and examines them. Sometime later, the registrar also sees the patients and may order investigations or tests. For example, X-rays or an ECG, make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions. They are people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patients is discussed with the registrar, consultants also decide when the patient is ready to be discharged. On the ward round, the consultant is accompanied by the team and nurse, and they visit all the patients in the consultant's care. Part 3, shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, from 7 a.m. to 3 p.m., and are then free until 7 a.m. the next day. After a week, they change to a different shift. For example, from 3 p.m. to 11 p.m. or from 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, which means they are available to return to the hospital if necessary. From 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager or bleeper, which is a device which makes a noise when someone is trying to contact them. We have been talking about hospital staff, medical teams, and shifts in this mini lecture. See you next time. Bye for now.